Hello everyone. Here we are going to discuss a very important topic, that is pancreatitis. Basically, we will be discussing two important types of pancreatitis here, that is acute pancreatitis or chronic pancreatitis. So in your university exam, either you get a long question, so you have to write down both the pancreatitis in detail, that is acute as well as chronic, or else you can get a short question on any one of them, either on acute pancreatitis or on chronic pancreatitis. So we will see both of them in details. Here you can see we are starting the topic, that is pancreatitis. So first of all, I would like to give you an overview. Under the headings, I would like to discuss this topic. So first of all, I will let you know the definition, what is pancreatitis. Then we will see the two types of pancreatitis in detail, that is acute pancreatitis and chronic pancreatitis under a fixed set of heading. I will let you know the introduction of each of them, etiology, that is risk factor for both of them, gross and microscopy for both of them, clinical features and complications. So we will make a comparative table between them. So let's start it. Before understanding the pancreatitis, you must understand the anatomy and histology of pancreas. So you can see pancreas is a intra-abdominal organ in human. You can appreciate this is pancreas. This is the intra-abdominal organ in human. Although anatomically a one organ, but histologically and functionally it's a dual organ, it's a double organ. So what is a dual organ? So it is having two parts, the exocrine part and endocrine part. Where is the exocrine part? This is exocrine part. The exocrine part is in the form of the glands. These glands are known as acini. These glands are known as pancreatic acini and they secrete enzymes. And the endocrine part, you can appreciate the endocrine part. The endocrine part is in the form of a collection of cells. A collection of cells, alpha cell, beta cell, delta cell. So these cells secrete hormone and the collection of the cell is known as islet of Langerhans. So we have two portions. You can see the exocrine, the endocrine. The exocrine part is in the form of acini and it secrete enzymes, and the endocrine part is in the form of islet of Langerhans and it secrete hormones. Currently my topic is pancreatitis. So pancreatitis is inflammation of the exocrine pancreas. It is the inflammation of the acini. So let's start the topic, pancreatitis. What is pancreatitis? You can see pancreatitis is the inflammation of the pancreas with acinic cell injury. That is, it is an injury to the exocrine pancreas, not the endocrine pancreas. So exocrine pancreas is the form of the acini, the glands. So the glands get injured here. And there is injury to the glands leading to the inflammation of the glands leading to pancreatitis. Itis means inflammation. There are two types of pancreatitis, acute and chronic. So I request all my dear students to take out their notebook, to take out their pen and start making this table with me right now. If you already have the hard copy of the book, you can start filling in the hard copy itself. The table is given to you in the hard copy. The table is empty. Intentionally it is given empty so that you can fill it while watching the session only. So take out your notebook, pen or book, whatever it is, and start filling it right now so that you can revise it in the end just in 1 minute. So let's start with acute pancreatitis followed by chronic. First we will see acute under these headings. So what is the introduction of acute pancreatitis? Why does acute pancreatitis occur? You know, whenever we eat food, so the food is going into the esophagus, in the stomach and the intestine. Whenever the food reaches the intestine, at that time the pancreas secrete the pancreatic juice. Can you see this is pancreas? Can you see this is the pancreatic juice coming in the intestine? So pancreatic juice contain many enzymes. Pancreatic juice is coming in the intestine via ampulla of Vater, and it comes in the intestine only when the food is coming. Whenever we eat food and food reaches the intestine, then the pancreatic juice is secreted in the intestine. So pancreatic juice contains many enzymes, but the three important enzymes are trypsin, lipase and amylase for the digestion of protein, fat and carbohydrate. So trypsin, lipase and amylase, along with many other enzymes also, it is secreted into the lumen of the intestine. But these are inactive. The trypsin is in the form of the trypsinogen. You can see it here. The trypsin is in the form of trypsinogen. Can you see? The trypsin is not active. It is inactive, trypsinogen. So once it is secreted into the lumen of the intestine, then in the intestine, these are the cells of the intestine, the enterocytes. They have enterokinase on their surface. This enterokinase convert the trypsinogen into trypsin. So trypsin is inactive. Trypsin is in the form of the trypsinogen. It is inactive. It get only activated when it is coming in the lumen of the intestine. And it get activated by enterokinase. So this is normally happen when we eat food. So we have trypsin, but it is inactive. So here it get activated only by enterokinase whenever we eat food. But in acute pancreatitis, there is premature activation of trypsin. There is premature activation of trypsin. Even without eating food, the trypsin get activated. Trypsinogen get converted into trypsin. Once the trypsin get activated, it activates all other pancreatic enzymes. Because of activation of all the pancreatic enzyme, there is